is the main message that we want to give to women, and then you'll find this on all of our literature. So this is the shower card, so I'm going to give that to you, and since you are young ladies, I'm giving you the young women's version of the card. Now, breast self-awareness. We want you to know your risk, get screened, know what's normal for you, and make healthy lifestyle choices. So know your risk. You need to talk to your family. Also, don't forget about your dad's side of the family, because a lot of people are like, oh, I asked my mom, well, what about your dad? And talk to your doctor about your personal risk of breast cancer. So for instance, my mom is a survivor, but when she was diagnosed, she was like in her 70s, so it was older. So when I talked to the nurse, she said, well, you know, your mom's cancer wasn't very, invasive, it wasn't aggressive, we caught it early. And since she was older, it's different when you're diagnosed when you're like 27 versus like 70. So although, my risk is a little higher than the average, at least I know. I had that conversation with my doctor. So you need to know what your personal risk is. You need to get screened. So you need to talk to your doctor which tests are right for you. So when you're 40, you need to get a mammogram, and then even starting at 20, because we don't want to let you guys off the hook for the next 20 years, you need to have a clinical breast exam. So that's when the doctor or the nurse, they palpitate the breast tissue and they feel around. So you need to do that every 3 years starting at 20. I say get it done every year at your checkup, because that's something that you need to get familiar with also, and the doctor needs to take note. Oh, she has dense breasts, or it's a little denser on the left side. So make sure that you know that. Which brings me to know what's normal for you. Now, you guys have heard of breast self-exam, right? Now, we know that breast self-exam is great. A lot of women have detected their lumps and their cancer through breast self-exam, but we think that that's just one part of this the 4 steps of breast self-exam. So you need to know that, okay, the left side of my breast on the right, it's more dense, or when I'm on my period, they get a little tender, or there's a lump there, it's always been there, it doesn't hurt, it's not, so you guys need to know that. So one reason we don't say that breast self-exam, do it once a month and you're done, because it focuses on the feel. You're like looking for the lump, looking for the lump, looking for the lump. But you'll probably see a little better on your card. 6 of the 8 warning signs of breast cancer are visual. So you might be looking at your breast and saying like, oh, there's no lump, but look, I have a rash. But it's not a big deal. You're not supposed to have a rash there. So you need to go tell your doctor. So, but because it wasn't a lump, you're like, oh, I don't have to worry about it. And what happens if you have like dimpling or puckering of the skin? You're like, well, it's not a lump, so I don't have to worry about it. That's not normal. There is a form of cancer called inflammatory breast cancer, IBC, and your skin looks like an orange rind. So it puckers and it dimples, and that's not normal. Your skin is supposed to look, smooth, and so if you see that, but you're like, it's not a lump, it's not a big deal, would you ever go see your doctor? No. So we want women to look at their breasts, and we want them to visually look at it and say like, oh, I wasn't there before, that's not normal, because you want to be able to tell your doctor, if you go see her and she says, India, how long has this, this rash been here? You want to say, oh, I saw it last week, I wore something itchy, and it happens when I wear this sweater, versus you saying, oh, I don't know how long it's been there. You want to be informed, and you want to know like, oh, that happens every time I have my period, or it's not a big deal. So you can say, I'm under control, I'm watching it, it's normal for me. But when it's not, you gotta go see a doctor. And you have to make healthy lifestyle choices. So you have to maintain a healthy weight, you have to exercise, limit your alcohol intake, if you guys are 21. I don't know about postmenopausal hormones or breastfeed if you can, but these are things that you can do, because you can't change like who your parents are and your genetic pool, and you can't change being a woman and getting older, but these are risk factors that you can change and affect your life.